All right. So, welcome to the October session of Being a Woman online breast cancer support group. This evening, we have with us Dr. Carla L. Fisher, who is a professor with the UF College of Medicine, and she is going to talk about navigating cancer and survivorship as women. So, Dr. Fisher, I am going to turn it over to you.
Thank you. Thank you so much for having me. I think anytime I come to a support group and have, the opportunity to talk with women, I learn something. And so one of the things I always want to, I'm not going to talk too long with slides. I think it's much better for us to have an open floor and open opportunity to talk together and to share space and to share stories and to learn from one another. But I'll share some of the things that come from the work that I do that I think we don't give enough space to in the clinical setting. That I think all women in particular need the space to kind of process and think about. Um, and there's kind of two spots that I'm going to talk about. But thank you, Pam, for inviting me. I had the pleasure of meeting Miss Pam at a survivorship event recently for the Cancer Center. And one of the things I talked about there that she thought would be, really good for us to talk about here was this issue on, how we're coping within the family, but in particular, how we're talking to each other. And one of the other things that she and I talked about, because one of my passions is really focused on women and women in cancer and breast cancer and blood cancers. And one of the things that women struggle with, and that we were just talking about, that power of saying no, is role strain. So I'm going to talk about both things. They go hand in hand. But one of the things that, we know to be true, and clinicians know to be true, and you all, I'm sure, know to be true, is that cancer is not something that women are experiencing alone. It's very much situated within the family. It's what I like to refer to as a family affair. And so this is something that, one of the daughters that I've talked to, because much of my work has, been in breast cancer. And when I first started in my career, all I focused on were mothers and daughters and breast cancer, and kind of recognizing that, the way, we were being treated in the clinical setting was as an individual or a woman or a patient. But we were not at all thinking about how, when we leave that appointment, we go home and we process it in our family environments. And this was our daughter saying to me, my mom says, I didn't go through this. We went through this together. It's like our thing. And so one of the complicated things with this is, yes, the reality is that cancer is very much a family experience. What's complicated is that we don't approach it that way in the clinical setting. It's very much, patient centered, but not necessarily family centered. And so what we're seeing is there's not this space for supportive care, and we don't see it across the entire disease continuum. And so that's really the kind of work that I focus on is, what is it that we can do to fill this gap? Because when I talk to families, they're very much talking about this struggle with learning how to cope together. And part of that has to do with the fact that we share experiences, which means we share the impact of that experience. And so it impacts us individually, but then how, my mom is doing is affecting how I'm doing. How my child is doing is affecting how I'm doing. There's this constant interlinkage. And so family members report same levels of distress, but what we also know is that we're putting families into this world of health and illness with what we call a psychosocial map. You get no guidance on how are you supposed to navigate this individually, but also with your loved ones. And so the work that I do is really about what can we do to support families. And so my focus, and what I'm going to talk with you all about today, is how we communicate together. It ultimately is core to our ability to manage care, but also to cope together. And the other component of that, which we don't talk about enough, and which is not also a part of cancer care, is this is really core to our psychological well-being, our social well-being, our mental health. And so I'm going to talk just a little bit about that, and then we can maybe, share some space too about how we're all doing that. So one of the things that in the work that I do with families, and then also in trying to get clinics to integrate some of the interventions and resources that we've built for families, is recognizing that how you're talking to each other and those patterns in your relationships, they are directly related to our health outcomes. And there's plenty of science and evidence behind this. So this quote here is something that my mentor, who when I was training, would talk about. And he would say, the interpersonal communication, how we're talking to each other that fuels our social lives, it's as essential to our survival as any other biological or physical process that keeps us alive. And so part of what we need to kind of recognize and thinking about and being mindful about how we're talking to each other, which is not easy, and we'll talk about that, is it has implications for how we're feeling mentally. So we see relationships with how we're talking with distress, levels of depression, symptoms of anxiety, even post-traumatic stress disorder. We also see it tied to how we're feeling in our relationships, how satisfied we are, intimacy. And then also we see it physiologically. So it can affect our immune functioning. And what we also see is this shared effect. So just one example in the work that I do with mothers and daughters in breast cancer, if a mom who has breast cancer is showing symptoms of depression or anxiety, or increased stress hormones or cortisol, their daughters have the same effects as what we're seeing. And so part of why that is how they're communicating. And so this is why I focus on this particular area. And there's,
Dr. Fisher, I'm sorry. Are you taking? Can I ask questions in
yeah,
between, or you
oh,
wanted to wait?
absolutely. You can
Okay,
do whatever
yeah.
you want. You can do whatever
Okay,
you want.
yeah. Because you laid out a lot, and can you go back one slide? Go back
Yeah,
one slide.
absolutely. Yep,
Yeah.
yep, yep.
With my work, and not just with my work, this definitely was me when I was diagnosed. But I didn't know. I didn't know that they had uh, some what I was going through. I thought I was just losing my mind, and I didn't know until I went to a mental therapist that, and she named what I was going through. So what I was going through had a name. You
Yeah.
know, I'm just thinking that something's wrong, but when I see here, and when I was diagnosed, I had no idea at the time that the mental part of it, I didn't have tools to deal with what was happening. So we pretend that we're okay. I don't know about
Mhm.
some of you ladies on here, but I pretended I was okay for somebody else. And I always tell the women who I've come into, you only be brave for yourself, not for someone else. You're the one going through this. You don't have to tiptoe around what you're going through. But explain PTSD.
Mm-hmm.
That's
Post.
what,
Mm-hmm.
because I think when we first hear that news, it's like we're in total shock. It's like paranoid. We can't move. We can't go beyond what we're thinking right then. It's like everything stops. But explain what PTSD is.
Yeah. Yeah. The post-traumatic stress disorder, which women can have it during cancer and after cancer. And it's not just women who are diagnosed, their caregivers can have it. And women who are caregivers in other illness contexts can have it. And it's some part of, it manifests differently for everyone. And sometimes it's associated with triggers that then you feel this kind of intense sense of flooding, or freezing, or
Mm-hmm.
there's just this absolutely overwhelming emotion where you can't regulate, and you sometimes can't pinpoint it, but it's the buildup of a traumatic experience over time and not
Mm.
having been able and having space to process that. And so it's something that, you know, like, especially when I talk to caregivers, they say, you know, I feel guilty. Like my husband's doing great, you know, and I don't know why I'm struggling so much. But you forget that you witnessed everything that your spouse or your loved one went through, or a daughter witnessing the mother. You witnessed everything. You don't have to be the subject of it. And that is traumatic. And that affects our minds, our bodies. And when we're coping with illness, we're surviving it. So we're in
Mm.
that survival mode. And so you're not giving yourself time, and you don't, in a clinical space, get the space to mentally process what you're going through. And so it can come up later.
And that's what happened. That you know, I experienced that, but uh, also speak on that other. I'm big on the mental part. I think you know a lot of women who've been diagnosed, they just go through the motion. You know they without sometimes without questioning, or if they have all these questions, it's a lot. You're
Yeah.
overwhelmed. It's almost as if you can't think because
Yeah.
you especially now with the age of the internet, you're googling everything. You know, I thought that if I had a headache, it was cancer. If I stubbed my toe, I thought that was toe cancer. What kind of stuff is that? Toe cancer,
Yeah.
but I'm just thinking that's how it gripped me. But what is let's go with like distress, like depression. I see that depression and see sadness versus depression.
Yeah.
What's the
Yeah. I mean,
difference?
oops, did I switch it? Um, I mean, depression is something that's going to be clinically diagnosed, but you can have symptoms of depression that are, you know, sadness. You can kind of think about it as something that you can feel, you can name it, and you can move through it. Depression is something that builds, and I feel can become unnameable as you're further kind of sinking into that mental state that then persists. And so it affects the way you are, you know, responding, whether that's how you're waking up every day, how
Mm-hmm.
you're responding in the moment. And it becomes a perpetual experience, as opposed to sadness might be something that you experience, right? And you can feel that, and you can process that. Depression is something that, you know, hasn't it comes with not being able to have processed those hard emotions when you're experiencing them. And that can be hard during cancer. Cancer can be long treatments. It can be up and down. It can be treatment transitions. And it can be, you know, you're in active treatment, then all of a sudden you're out. Like that, it's a bit of a whiplash, you know, feeling. So
I like that word, whiplash. Yes.
So it's not uncommon for mental health disorders to manifest. It's also not uncommon um, for things that were challenges to us before cancer to rise to the surface when we're facing cancer as well. And so it can be sometimes the first time that, you know, you're having an opportunity, you know, to process things that, you know, you previously experienced and are coming up for you too.
Okay.
Yeah.
Are there anyone else that would like to ask a question? Please. This is a very important. This is besides AI. This is one of the. This is one of our best,
Right.
topics that we can speak on. So please don't feel you. This is a safe space. Please ask the questions because see, don't take all that on. You've got a therapist here, at your disposal. So take advantage of it.
Oh, that's sweet of you.
Well,
And
I
I,
have a quick question. Like, I feel like so much of treatment is like getting your physical body to survive, and like they kind of like forsake the mental part, like it's all about your physical, physical, physical. Like, we got to get you
Mhm.
to survive, survive, survive. And
Yeah.
like at the same time, there's a loss of like, okay, like, why? because I'm in like the phase of picking up the pieces. Like I'm like out of active treatment, out of chem like 5 weeks out of chemotherapy and like exhausted and like taking off the mask and like,
Mm.
I am like I'm tired and I feel like a shell of a person and I don't want any more medical care ever. I mean like you go through like that phase and I feel like it was all about getting my physical body to survive and yet my mental health kind of got like dragged through the mud there for a bit.
Yeah. Yeah. I mean, you described it perfectly in the sense that in the clinical setting, there's the goal is survival, right? And that is largely physical for clinicians. And there are some places that, bridge them together, that you're automatically paired with a mental health therapist or a social worker, a licensed clinical social worker at the same time you're in treatment because they know this is also affecting you mentally. But a lot of programs don't. And so unless you have the space outside of it, you did exactly what everybody does, Chelsea, which is you keep going with the physical health. And now you're at that point where things have like come down and you can hear your mind a little bit louder than what you've been allowed to have space for. And so it can you're probably feeling like it's like, you know what I mean? The water's bubbling up now. And what is this? And it's that,
Well,
mental
and
process
not
that you
not
didn't
only
get
that,
space
but
for.
like it's like now I'm on tamoxifen, which causes me anxiety even worse. And like so like the hormonal blockers that I'm now on are causing like a little bit more of the underlying mental things to like kind of rear to the surface. So
Yep.
like it's very difficult to kind of mitigate those things and it's difficult to communicate effectively and efficiently when you have hormones, you lack
Yeah.
estrogen,
Yeah.
like it's very
Yep.
difficult to do that. And so I want to be open and do the right thing and be the better person and communicate openly and be that person that I want to be, but in that moment of lack of
hmm
estrogen, it's very difficult to do
hmm
that. And I'm trying to like, I'm kind of weeble wobble, but I'm not falling over yet,
Yep.
And so like, I'm
Yep.
really trying, but it is difficult.
Yeah. And you have to have the space and the grace for yourself to know that absolutely this is extremely hard. And now you've been given a physical shift in your body. That's one of the hardest things for male, female to go through. And at the same time, catch up with your brain and what you've just gone through and what your new reality looks like while your hormones are so out of whack that you have to learn how to like regulate that as well. And these are all things that I think clinicians put the weight on patients to bring up. And we don't have like at least at UF Health, we don't have a survivorship clinic that would focus on these things because they know about the hormonal shift that you'll go through when you're on tamoxifen or maintenance therapies. But there are things that you should be bringing up with your clinician, as well. And be patient with yourself. You're at a huge transition mark. Oh, Pam, I think you're muted.
Miss Fox, did you want to ask Doctor? I saw that you had unmuted. Do you want to
Oh,
ask
thank
her?
you for that.
Yes, I actually personally am kind of at the beginning stages of everything. It's been like a whirlwind, right? I think that my faith, thankfully, and my church family and the community that I've built around me definitely helps with a lot of these coping issues that you're speaking on. I actually am a daughter of um, a father who had cancer. Both of my sisters had breast cancer, and one of my brothers has prostate cancer, and my paternal grandmother also had breast cancer. And I'm the youngest one to be diagnosed in my family, but also am a nurse, so I was kind of like mentally aware this might be a fight I had to do. I joined this forum to try and just hear other people's stories and to figure out, you just touched on questions that we should be asking. I those are the kind of things that I'm interested in because I want to know everything that I can about what I'm going through. Um, like, is there some kind of like suggested list of questions that you would, think to ask her? Because I know pharmacological world, but I don't know specific cancer meds. Oncology is not my thing. I'm a rehab nurse, so
Mhm.
when I hear like tamoxifen, I know I give it to patients, but I have no idea what the huge
Yeah.
ramifications are for those versus someone who's older and my age or younger, etc.
Mhm.
So my two big takeaways, what I'm hoping to get tonight, is to hear other ladies' stories and just like what this journey's been like for them. I personally just cut my hair. I don't know if you can see on my video, but I personally just cut my hair because it's a choice that I decided that I was going to make. And me having control over that makes me feel like, or it made me feel like at least there's like some say in this world where I have really no say in what's going on. I don't really have a choice as what's going on. I need to obviously do this to survive for my family. But I would
Mhm.
love a resource of questions that I should be asking.
Mhm. I was gonna wait and see if anybody else is gonna. Have you been paired with a social worker?
Not from the University of Florida. I actually live in Ocala. So I don't necessarily have a social worker per se in Ocala, but there is a nurse navigator from Florida Cancer Specialists where I'm at, who actually herself, her and her other colleague who is my oncologist scribe, both of them just recently went through very similar treatments for different processes, not breast cancer, for different things.
Mhm.
But they both just recently went through treatments themselves at their job.
Mhm.
So honestly, it's been again, I liken it to faith. I prayed that the Lord would open doors and make connections to where I could have all my questions and just be supported and be answered. Um, and I believe that I have that in them. They took so much time with me to explain. My doctor as well goes to my church, so that helps a lot in the sense that
Mhm.
I entrust in him because I know that our values align, and I know that there's a hope either way, however way this is going to go. But my hope is that this is going to be a positive outlook. I have 5 children, so I
Mhm.
certainly have lots of reasons to fight for.
Right. So I think like one of my like first recommendations is always be ask for the navigator. And if there's not a navigator, because every program is different, to ask for the assigned oncology social worker. And sometimes you have one and sometimes the other. To me, they are the best resource in terms of your question list specific to that department and that diagnosis,
Okay.
that is also the most up to date. And so and they also are the two sources that seem to understand it on a spectrum of issues. So it's not just physical health, treatment related. They know all of that. It's also financial. It's also grants that are out there. It's also the social, the psychosocial. So to me, like I believe that you need to always make sure, and this is for every patient, that you have contact with a nurse navigator and or a clinical or an oncology social worker that's teamed. And usually there's at least one of those within a
Mhm.
program. The other thing I would say for you, if somebody has not talked to you about this, is I work a lot with high risk families. And
Yeah.
what you've described is a family system that is of elevated or high risk. So we would say high risk if we know there's a genetic mutation. But because you name breast cancer and prostate and you have multiple within your family system, if you have not already done genetic testing or if it's been a few years since you've done it, I would do it. The chances of you being BRCA 1 or 2 mutation are probably low. Usually we see that with like Ashkenazi Jewish families, but we
Yeah.
don't see it with the bulk of patients. That doesn't matter. You can still have other genetic markers that come back, in particular the one that's associated with prostate cancer, that can ultimately give you and your children and your family system better information about why your family is more prone to developing this. So you're a previvor, you know, before you had cancer, your children are. We call previvors people who grow up feeling like it's not a if, but when, because you're already surviving that, and you survived your family's experiences with cancer, right? So we give you that label because you've earned that label, and it's something you have to learn to cope with. But when you said you had 5 children too, if you have not had that space, I can connect you with 2 genetic counselors at 2 different spaces that are phenomenal people to talk to as well.
Is that through UF?
There's one through UF, and Lisa Brown runs that high risk program. There's another one at North Florida. I'm actually a patient in the high risk program at North Florida, and that's run by Danielle Rogers. I love both. I work with Lisa Brown, and my practitioner is, Danielle Rogers, because my oncology care is all through there. I'm high risk, not a patient myself. But I've worked with women in this space for 20 years, and that science moves so fast that even if you did genetic testing already, or somebody else in your family did, you need to do it again. You need to be doing it ever so often.
That's something I thought that was cool with the oncologist that I pick, is that he's a high risk oncologist. But a big thing is that he sends our stuff, once it's all said and done, to some lab somewhere
Myriad, probably.
There it is.
Myriad.
That's the name. That's the name. Who will forever call us or something. Anyway, I am curious about genetic testing. I'm glad you brought it up, because I got the test done through my primary doctor's office. I don't have results back, and it is a federal funded. It's Heart of Florida. There was not genetic counseling offered through that. So no one's counseled me with genetic counseling yet, but I did do the BRCA comprehensive panel.
Yeah.
Was ordered.
But and that's what everybody tends to do. And I'm not a genetic counselor, so I'm not an expert in that. But there are other panels that can be done, and that should probably be done with you, that are not the BRCA. The BRCA is not, I mean, it's the one we know most about because it's the most research that's there. But that's not the biggest population of people who have breast cancer. And there's others that are associated with prostate cancer that are different. There's other markers that you can be looking for. So I like Danielle Rogers. I think I have it right on my, she's the general nurse practitioner. She runs their genetic counseling. She is phenomenal, both in pre and post testing counseling.
Yeah.
And if I
I'm just writing it down somewhere else. You said that's North Florida?
Yeah, it's through HCA Healthcare, and she's over there. And it's relatively new. They stole her from some Georgia system to create their own. So they're doing a great job. And then Lisa Brown is the one at UF Health who's phenomenal as well.
Yeah,
my oncologist actually works for the HCA system. So
okay, so then
we had Dr. Brown on in March, and she's on our YouTube. We had her in March. See, I told you, y'all better come. We got it going on here, But Dr. Brown was on in March, and
she's awesome.
we asked her to come back, because we put Terry, if you can, put up a link from our YouTube channel, you can watch that. And she had valuable information on genetic testing, and it was free, and I had offered. So if you decide that you want it, we will arrange for it. We will work with them for you to have it. Okay.
That's
So
awesome.
yes, yes, and that's oh goodness. Thank you, thank you, thank you. I'm just in awe. This is so important. Before we move on, Dr. Fisher, you know I want you to come back, so that's all I'm gonna say. Okay.
I would love to come back, Miss Pam. Thank you. No, I'm glad this is resonating. And I'll fly through these because I want to be able to like talk about, you know, your experiences with these, and then also, you know, ask questions and whatnot. The two kind of big patterns that we talk about in with families is openness and support. And so they go hand in hand. If you're talking more openly, you're opening the door for support. So like there's plenty of health associations with both of these. You can see these, I won't read them. Less distress, you know, opportunities to cope together, you know, and when you have openness, it leads to the support communication, which reduces our burden, reduces feelings of isolation, and it also functions good in our psychological adjustment. The flip of this is what we're often trying to get families to do, and what we struggle with anyway, we all struggle with this, is avoidance. And so the reason why we want to move families away from that is we do see higher levels of depression and anxiety, so poor mental health. We see increased stress hormones, so we see the poor relational health and the poor physical health. These are the conversations that in our research, and this is across different cancers with different relationships, different patients, caregivers, it's these three come up over and over again. Talking about our future, the uncertainty, whether that's recurrence, whether that's end of life planning. But we know when families have those conversations that they have opportunities to repair bonds. They can also ensure control over decision making. And it also reduces tension among the family later in life if those decisions have to be made without family assistance. The other aspect, and this is a big one too, is expressing or hearing distressing emotions. So we love positivity. There's this big shift, right, over the years of got to be positive, and you know, if you're positive, you're going to be fighting it, and that's the healthy thing. You can't be positive without getting and releasing the negative and processing it. And so we have a knee-jerk reaction to silence somebody when they're releasing some of those emotions. And when we do that, we restrict their ability to, you know, lessen their fatigue and pain, depression, have their concerns validated, and create a realistic kind of narrative. So that's one of the other things we teach about how can we, you know, allow ourselves to have that. And then the last is caregiving burden. And this is on both sides, feeling like a burden, also not being able to share caregiving burden. So it's both for the patients and for those of us when we're diagnosed with cancer. So these are the hard ones. That being said, this is something that I just always share because it's something we teach in our interventions, because it's hard to facilitate open and supportive communication. And there's some families that have a history of coping more openly and supportively, and there's some that have less, and all could use some help with this, particularly when you're facing cancer. And so one of the things we always kind of talk about is if you are doing what we call the ties approach. So the ties approach is, you guys probably have heard this at some point, but one of the things we talk about in family research and psychology is how do we cultivate family ties that bind? So like family ties, relationships that are strong. And one way to strengthen that is how we communicate with one another. And so one of the things that's why we call it the ties, just easy to remember. And so we remember to take the lead. I've got to be the one ultimately doing these 3 steps. So if I'm taking the lead and modeling for my family how to communicate, I can do that in 3 ways. I initiate the conversation, because sometimes what happens with family members is I'm not going to bring it up if they're not bringing it up, because it's just going to upset them. So we go ahead and we open that door and we initiate the conversation. We let you know that this is something that's okay to talk about, and we want to talk about it. We sometimes meet resistance with that. And so it's important to explain the importance of that conversation. And then to sustain that openness in that conversation and not be the first one. Because especially when I talk to mothers and daughters and we'll talk about risk, let's say, when you're, and you, I'm sure experiencing this is, when you're coping with cancer, you're ultimately thinking of your children's risk in the future. And so sometimes, parents want to talk about that with their children. And it can be and then, timing's everything and age appropriate's everything. But sometimes it's just little conversations over time that ultimately lead to this more open and supportive environment. So it's not something that happens overnight and with one conversation. It's something that we have to constantly be doing. These are always behaviors that we teach, the importance of listening. And what's hard is to listen without saying anything, which can be powerful. Laughing, easing stressful moments, the expression of love, validating feelings, what I call healthy doses of positivity. It's okay to be positive, but let's also allow for the expression of sadness, fear, anger, how to reframe things, and also to be more directive so that you're getting the help that you need and also preserving the control that you need, which we know we're all so robbed of. The thing that I don't want to gloss over, and that has to do with the last thing that I'll talk about, which is, why this is also a struggle for women, is there's these tensions that we feel, and we have to get used to being okay with feeling different things that are completely opposite at the same time. And both feelings are valid. And so when we're negotiating how to be more open or talk more openly, or to allow our family members or loved ones to do that, we feel these three tensions often. You feel this openness, closeness. So this is a woman talking about, I don't want everyone to know how I feel. I don't always think that they have to know what I'm thinking. My daughter doesn't need to know everything. Sometimes she thinks she should. So there can be a pull, twisting, right, in terms of how much information you want to give, how much you want to share. Then there can be this issue of, I want to protect my family. I don't want to cause them more burden. I don't want to cause them worry, but I also need support. And so this woman says, I tended to gloss over things. I didn't want my family worrying about it. I just wouldn't say anything because I didn't want them to be concerned. I didn't tell them much because they were already going through enough. I didn't want them worrying about me. And sometimes women will say, at the same time, though, if they're not worried, I'm not getting what I need. And then this independence dependence. I particularly see this with, older loved ones, and then also younger women who are diagnosed with cancer. This is a daughter talking and she was in young adulthood, and she was saying this about her mom. She's like, I like it, and that she'll offer whatever you need, just tell me, but not pushy. Not, I'm coming down there, I'm taking care of you. She was really happy when I asked. She wanted to be wanted that way. But there is this, how much control and how much am I going to let them into that space? The other kind of aspect of this is we tend to use avoidance or silence as a protection. And so usually you're engaged in that to protect the other person or to protect yourself. And so we always want to be thinking about, is it actually doing that in a healthy way? And oftentimes what we see with avoidance is it can create more distress. So we see this with younger, where this is a daughter saying, if I could picture everything, it helps me, makes it more real for me, but in a good way. It didn't make it this big, giant, scary thing. My mom had been reluctant to tell me, and I said that this is the way I want to do it. She wanted to protect me, but that was harder for her. The other aspect is withholding. So this is a mom who talks about, she says, when my daughter wasn't okay, I realized my heart would drop. It was just visceral. My body would react. It was alarming and sobering how much I was affected, but it also put pressure on my daughter. She wanted to hide things from me. So there's this pull back and forth of what can happen with the withholding of needs. And then that feeling silence that I talked about before. This mom's like, if I talked about cancer in a negative way, my daughter was not happy. But sometimes just let me get it out of my system. Allow me to talk more. They just don't want to hear it. So that silencing effect can happen too with the avoidance. This is the thing where I think it's even harder for women. And part of this has to do with the roles that we play in our families, in society, as women. And so when we talk to women, and this is no matter what the cancer type, so breast and other types, doesn't matter the age, you know, in adulthood. And it doesn't matter, you know, if they're mothers, aren't mothers, married, not. Women with cancer talk about experiencing distressing role conflicts related to cancer, employment, relationships. And they especially feel guilt with this idea of failing to successfully balance all of those roles. And so, you know, this first quote is about, you know, from a woman kind of describing that. She's like, I just feel like I don't have enough time to put into all of these relationships that I need to. And another woman reflecting, I think women have been given so many false representations of what balance looks like that that's not achievable. And that can become kind of this overwhelming experience in the scope of cancer, where what we've seen is that women with cancer express feeling morally obligated to overcome cancer, but simultaneously want to prioritize the needs of their family. And so what happens then is this really challenging experience of how do you then prioritize what your needs are in the face of this illness. And so this is something I always want to, I talked about it with Ms. Pam, and I always like to address with women. And it's something that in my research and with other colleagues, we've called it this idea of responsible womanhood that seems to happen, where, you know, what are the roles that women are responsible for, and what are the roles that should be prioritized? And what we see happening in cancer is we see women oftentimes prioritizing the role of mother and wife, or their role in society over that of patient. Or we see them prioritizing their loved ones' well-being over their own. And as women, we've learned to, you know, be socialized about what those expectations are for us in society. And it is to uphold the family and to put self after other, so to speak. At the same time, those roles shape who we are, and they give us a sense of purpose and identity. And so it's a challenging aspect of coping with cancer. And so this woman said, you know, I think there was an expectation that mom would look after the food, and mom would look after the cleaning, and so mom would take care of the home. And this is all in the midst of cancer. But so there's this challenge that comes with this notion of responsible womanhood, and how do we cope with that, and how do we navigate that? And part of that can be cultivating that more open and supportive exchange. But we also have to recognize it's not always so simple. It can be both health promoting to have those rules, and it can be inhibiting. And so one of the things is, you know, it can be motivating, can fill us with purpose, make us feel like ourselves. So this woman says, you know, my work has been really good with letting me work 2 days a week. I find it gives me purpose. It gets me out of bed, makes me feel normal, to be honest with you. And that's what I appreciate. And so recognizing it's not so simple of, you know, separating the two, but how do we find what works for us? Because the challenge then is it can make it harder to cope together as a family or within your system of loved ones. So I always give like just a couple of examples of that. And this is something that as women, I think we forget as we don't say no. We were talking about that early. We don't say no. We try to, maintain and keep it all going on. And we also try to buffer our loved ones, right? So these are two different relationships. This was from a wife and a husband. And what that ultimately inhibited was his ability to be there for his wife in a way that he wanted to be there for his wife. So sometimes in trying to do it all and be that responsible woman and to prioritize everybody's well-being, we take away space for other people to be there for us too. And so she says, I was kind of stubborn. I really didn't want to bother my husband about what was I thinking about. It was our problem. And he kept assuring me that he didn't marry me for that kind of stuff. He was there for me. He really wanted to be more active in all the appointments. And I kept saying, it's not that big of a deal. Let me just do it. I don't know why I did that. I thought of that. You don't really involve more people than you have to. Even though he was my husband, I didn't want him to get in trouble, say from work, stuff like that. and her husband shared in an interview, a separate interview. You know, as things progressed closer to the surgery date, I felt like I was left out more and more. You know, she's taking her friends to her checkups. I had to go to work. I wasn't allowed to go. To me, it felt like that was my choice. I think she didn't want me to worry, is what she said. Okay, well, that was that. To me, it felt like that was my choice, as in that was the choice he was given. And this latter one is from a daughter. And so the mom says, you know, I tended to just gloss over things. I didn't want her to worry. I didn't tell them much. They were already going through enough. They were both going back to school. I didn't want them worrying. And her daughter says, you know, she doesn't want to make me feel bad or something like that. It would kind of bother me a little bit that she did that. She would try and hide it. And sometimes she could, but sometimes she was not good at it. So it's kind of one of those other aspects when we struggle with that openness dilemma, is remembering that it opens up those doors for support. And so there's strength in that. There's strength in asking for help, but there's also strength in accepting it and recognizing that it's not just sharing the load, but it's also might be giving somebody else an opportunity to support you in a way that helps them feel, you know, a certain way that helps them cope with what they're coping with on the other side of it. So I'll stop there. I always want to make sure that we share space, whether it's talking about what we did, you know, tonight in terms of openness or role strain and the struggles and strengths or goals that we might have, or other areas that you all wanted to talk about too. And I just thank you for letting me into your space. And I always like to share this picture because it's like my cousins from way, way back in the day, of which breast cancer has been in my family since my mom was a child herself, and the oldest, she was the youngest of 8, and my mom's oldest sister was the had 4 children, 4 girls of her own. And this was back in the 70s, 60s and 70s, and that she died and had 4 girls. But since then, the generational tradition across the entire family, so my mom, who had 6 sisters, and then, or 5 sisters, she's one of the 6 girls out of the 8, and then they've all had daughters and daughters and daughters, and it's gone on, and they're still going to the events in order to honor. And so it's one of those things that I think lives on with women in a space that is generational as well. Let me stop there and also open this up and stop sharing. There I go. Sorry. I am not technologically savvy.
Neither am I. I wanted to add, when you were talking about the responsible, when being responsible,
Womanhood, yeah.
Sharing the journey, sharing your journey, with, whether it's with your loved ones or with your friends, you know, it's not like a once. It's how can I say once? It's not a one size fit all.
Mm-hmm.
You know, it's not. And some may get may feel left out, but I you know, when you was reading that, and I it took me back. I didn't know what to share, whether I
Yeah.
needed to share, because they I had some family members that came over when they found out. And just so you all know, I'm 25 year survivor. Okay. So, but I can remember like it was yesterday when they came to, you know, when they found out I had cancer, you know, and my uncles, they came to the house, and I felt like people were coming to see, you know, like they were coming, like it was a funeral. You know, they made me feel like, you know, they were coming like I was about to die, you know? And so I had to pretend. And then they looked, oh, Pam, all right, she's okay, but I wasn't okay, but I had to pretend because they came over with this sadness. And I didn't want that. I was already sad enough, and so I had to pretend, you know,
Mm-hmm.
even though I was feeling what they were thinking, but I didn't want to share that, and you know, so
Yeah.
it's like you don't know what to do. You don't know what to do. You don't.
But you just described exactly what we do, which is you didn't share it because you're you're protecting them. You're seeing them sad, and you're sad inside, but you're keeping it inside, so there's part of that goes on. The other thing I think is really important that you said is we sometimes we need to draw those boundaries in the sand, in terms of what you need and when you need it, and that can be helpful too. I also gotta say, I love that you have a social network of men that showed up for you. That's not always true for women with breast
I
cancer.
know. Yeah, they showed up. May not have been in the way I wanted,
Yeah.
but they showed up. You know, but they did. And thank you. I just when you said that, I never thought about that. That they did show up.
They
You know.
did. But you still prioritize how they were feeling, like
Mm-hmm.
yeah. And we do that for a long time. Like, Chelsea described early on, like you're just treading water and holding your stuff in check. And then something changes, whether it's treatment or something, and it rises to the surface and those feelings come up and you're like, what is going on? And part of it is prioritizing what you need in that moment and each moment forward.
And I think sometimes people come over for themselves too, like, and it's like they come over for how they feel, and like, and allowing space for that, because like it's like a very big grief process too. Like, I don't think like, and until like to Pam's point, to validate her, what she said, she felt shock in the beginning, like those are the beginning stages of grief. And so like, and she said once you put a name to it, you really realize what you're going through, and it kind of demystifies it in a way. And to know that you'll feel grief, you'll feel the shock and the denial and the anger and the bargaining and the acceptance and you'll feel the different stages of it. And it's very much a grieving process. You grieve for what you lost, and who you've become, and you're a different person at the end of your journey. And it's
Mhm.
you're as you accept things and move forward, you question why it happened and how you're going to move forward. And there's a lot of different like micro stages to it. Like,
Mm-hmm.
it's
Yeah.
not just all like it's not a one size fits all, for sure, like Pam said.
Yeah.
But you know what, Chelsea? When you said that, grief, I was grieving because I lost my independence.
Mm-hmm.
That's what you know. What that bothered me more because I couldn't. It limited me from doing certain things, and so I would push myself, and I know, and I hear this from other women. They'll push themselves, even though they're trying to get adjusted to the chemicals that may be in their bodies. And I tell them, I say, you push your body, it gonna push back.
Mm-hmm.
It's also trying to understand what's going on with my body, and you pushing it because, oh, I got this. I'm gonna do what everything that I was doing before, but we can't. It's limited, and then so you push and you push, and then I fail. I fail because that was my independence, and that's what I lost. That's what I grieved too.
Mm-hmm.
Yeah, that
Yeah.
was me totally. I was like, I'm a badass. I'm not going to lose my hair to chemo. And 3 days later, it all fell out, like in chunks. And I was like, oh, I'm not going to, I'm not going to be like, losing my hair and having to cut it off. And and I was not a badass when it came to chemo, but they gave me steroids, which helped me feel better and made me feel like Superwoman and everything. And having to navigate even that is difficult at times,
Mhm.
because you're under the influence of chemicals which make your body feel much different than you would feel normally. And
Yep.
that impacts your mental health. Like,
Yep.
it's a very multifaceted, multi-pronged situation. And I don't think like
Mm-hmm.
that's really, really recognized by a lot of people who don't have cancer on their radar, who may not never have gone through it or something like that.
Yeah. There's an intersection that happens. We see it with kids too. Kids, like the pediatric patients and the adolescents that I talk to, their mood switches with all the meds that they're on. So it's hard to parse out what it is. All that we know is that it's happening, and there's no space. You have to create that space, whether it's with a social worker, a nurse, or a support group like what Miss Pam has, offered the community, or a mental health therapist, or your family, to be able to just have space to name it, share it, and lighten your load.
Well, so I actually have a question about lightening my load. I'm on the phone, guys. I have a amazing support network. I actually lead a lot of women in 2 different Bible studies that I do, and they are just chomping at the bit to do every and anything. And I'm like, I don't know what to tell them. I'm like, I just don't know what to tell them, and I'm like, they like, I would love insight from anybody who's already been through this. Like, I don't know what I need. Like, they are like, how can we help you? What can we help you do? And I'm like, nothing. I'm like, my life is until I start chemo on Thursday, coming up this Thursday. That's my very first treatment. I got my port placed yesterday. I don't know what to tell them, and so they're just kind of like, well, do you want us to come sit? And do you want us? I'm like, well, I just don't know. I don't know. So if I would take any advice of what what should I need? What do I need people for? They're all willing to help. I just don't know what to tell them to do.
There's a registry called wegotthis.org, and you can register yourself, and like if you need things, like if you're doing like different types of chemo where you want to ice your hands and feet and you need stuff like that, they can buy that, or they can, like, it's like a registry, and they can buy you what you need for chemo, and like just little comfort items and stuff that you'll, like might be helpful along the way. And so it's like yeah, wegotthis.org, and it's really helpful. And if they want to do something like, that, and if they can't be there, they can be there in spirit, like through little comfort items and stuff.
Okay.
Yeah, and
I
that
like
takes
that.
the burden off you to constantly be telling and figuring it out, right? I love that, Chelsea. That's a great, it's like, the registry that you want to create for whatever, it's
I like that
people
too.
can just go there.
Mm-hmm. And then you mentioned that you also have 5 kids, right?
Too.
Do you need help with them? Like,
So, I mean, again, I actually, my mother and father they've predeceased me already. I don't have parents per se, but I have a phenomenal church support group, and my children's godparents. They're a big source, and I mean, I've scheduled my chemotherapy days on the days where I have a lot of friends who actually work at our church. They can flex their hours on that Thursday when I have treatment, and then they're off on Friday to be with me. So I really do. I think I've teed everybody up to do what they can do. I have a running meal train for the next 5 months on Thursday, Friday, and Saturday every other week. I have someone coming, 2 people coming on Friday to my house to just clean my house and babysit me and 2 out of my 5 kids, until my mother-in-law could come and to give her a little bit of a break in the afternoon. So, I mean, I just don't know, what else tangibly I can tell them other than come sit with me, because I know that I'm very sensitive to medicines, and I hear I'm going to get Benadryl IV, and that turns me into a whole nother person. I don't remember much when I take that. Um, so other than that, and telling, like, I just don't know. My sisters told me they pretty much slept like one day and then everything was fine and back to normal. So I really just don't know what to ask for. Because I don't know what it's gonna be like. I don't know.
Why can't you just wait until you do?
Yeah,
That's what I'm trying to figure out. They keep,
Yeah,
it
yeah.
is.
yeah.
I'm
It's
like,
all
you
gonna,
just wait until you do. You
yeah.
know.
girl, but I was like this morning, but I'm like, I don't know what you want me to tell you. I don't need you to do anything for me right now. So,
Say not yet, but
Yeah,
maybe in the
it's not
Yeah.
right.
future.
This is not like, oh yeah, I did chemo last year, okay, or it's not like you run into the grocery store, you don't know. It's okay to say you don't know. You may not. Remember when I said one size fit all doesn't fit all? You don't know. You may not feel this what the other person felt. You may feel something different, and you may need something. Your needs may be different. Take you a Sudoku book and some music. That's all I can, and go from there.
Yeah.
All right.
Okay.
The only other quick thing I would say, because I know we're at time, is make sure that within that circle that your kids have somebody that they can talk to about it. And like it can also help for at least one teacher to be aware of what you're going through.
Yeah.
Because if
Well, that's
they're not
gonna get
having
sensitive
that
for us.
space, what?
My daughter goes to a Christian academy, and the school had a pink out day for us today, which was really
Okay,
nice.
awesome.
Oh,
Awesome.
nice.
Awesome. As long as they've got open space, then that's good.
Yeah.
Oh, does anyone else have any questions or for Dr. Fisher
Thanks
or
for having me, y'all.
comments? Okay.
Thank you, Dr. Fisher,
Yeah,
for
yeah, of course.
thank you so much.
Reach out and
I
everybody
appreciate
can.
you.
Yeah, I appreciate you. I wish I could hug you right now.
Virtual
Yeah,
hugs.
but
I know.
I
Feel
definitely please put us on. Look at your calendar for next year. We done.
Okay. You
Next
just let
year.
me know when. You just let me know when.
I would. I want to have you come back and talk about, because I am a big mental health advocate. And
Yeah.
I told you about my story, so
Mhm.
I
Yep.
just would like for you to come back.
Yeah. Anytime. You tell me when. You know how I do it. If I got my girls in tow, I got my girls in tow.
That's right.
I'll be
That's
there.
right. That's right. Okay.
And
It's so
then,
nice to meet you all. I appreciate you.
yes.
Yeah, it's nice to meet all of you. Out of Chelsea, was Jay Fox. Thank you all. I know Jen. Thank you, Jen Jackson and Sonia. Sonia, you there? Okay, I'm gonna call you later. All right,
And
then.
then,
What is
and
the
this,
frequency of this meeting? I just Googled it, I think. So I don't, is this
yeah.
once a month? What is that?
Yeah, so I was just about to say that because this is
Okay.
super important, right? So we meet January through the last Thursday of every month, with the exception of Thanksgiving and Christmas because of, the way they fall. However, if you need anything between now and January, please let us know. Now, another thing, just because we're not meeting virtually in November and December because of the holidays, you are all invited to join us if you feel like it, Miss Fox, on not September, Lord have mercy, December 6th at Bahama Breeze in Sanford, Florida. And it's in the email that should be coming to your email right now or
Okay.
within the next 30 minutes. We're treating you to lunch at our celebration of life at Bahama Breeze.
That's our Christmas party.
That's our Christmas party, and we like to come together in person and fellowship.
Yes, and that's what, and you're all invited. So if you got the email, please RSVP,
Mm-hmm.
and you can bring a +1.
Mm-hmm.
And there's nothing. We're not asking you for a dime. We just want you to come and fellowship with like-minded folks. And most of us are all breast cancer survivors and women who are in treatment. So we would love for
Yes.
you to come join us, and come celebrate with, for the holidays, because we know that can be a time. Well, a lot of people ain't married, okay, during that
Right.
time. Okay, they're not festive, but we want you to come and be with us. If you can, y'all can take the drive or have somebody drive you. So
Right.
where are you, Miss Chelsea?
I'm in Gainesville.
Okay, if I can go to Gainesville and bring the mobile unit, you can come. Now, Miss Fox, I think you said you was in Ocala. I was just in Gainesville, and I'm always in Gainesville and Ocala. Uh, we were just at Paddock Mall. We did an event there with the mobile unit with University of Florida, the connector, Connie. So Gainesville, I'm always there too. So y'all come if you can. We would love to have you.
The
And
San
Miss,
Orlando area, correct?
yes.
Yes.
Okay.
And I'm actually in Atlanta and I drove down last year, but I won't be coming this year
Oh
because my
my.
family Christmas party is the next day and my mom and I have to bake for about 80 people. So, but what I was also going to say is, you all have our phone number that's on the website as well as the email. Just because we won't be meeting in November for the support group and also at, around Christmas for the December support group, if you feel like you need to talk, call Miss Pam.
Yeah.
Miss Pam, even though she will be resting, Miss Pam is still available.
I
Sonia has called. Sonia has been there for other members and stuff. So we are here for you.
Yes. And
Awesome.
Jeanette, I hope to see you this December. You too, Sonia. Y'all coming again?
I'm hoping to.
Sonia, what's wrong with your volume?
Nothing. You can't
Oh,
hear?
okay. I couldn't hear you.
And then you all will hopefully get to meet some of the other members who are
Yeah,
not here
there's
tonight of our
others.
support
There's
group.
others, yes.
Yeah,
So,
I think collectively, I think we're probably up to about 100.
Wow.
So, and that's why we record it. We've had women join us from London. We've had women join us from India. We've had women join us from California, so it's as their schedules permit. And most sessions, if we have a guest speaker, they are recorded. But if it's something that Miss Pam and I feel like, no, we shouldn't record it, it's not recorded. And so that's why if you go to our YouTube channel, you will not see all the recordings because we're very mindful of everyone's privacy. So,
absolutely. Miss Fisher, you can come December too. Bring the girls now.
Thank
yes.
you.
All righty. Well, thank you all. Have a beautiful weekend. Be safe tomorrow if you have kids that are going out or,
It's gonna be
doing all
cold.
of that. We're so far beyond that. We're empty nesters. So we turn our
Yeah,
light out.
they'll
That's
be
right.
bringing
My
the
lights.
sparks out there.
Yes.
Well, happy
Okay.
So,
Halloween, happy
yes.
All right.
Thanksgiving.
Okay.
Yeah.
Come on.
All right,
You.
everybody. Thank
All
you.
right.
Bye.
You and good night.
Bye.
Bye.